Welcome back to the SevereMMA YouTube channel. Today we have a very different interview than usual. I'm joined by Ian Coughlan, a professional Irish MMA fighter who, unfortunately, in preparation for a fight, suffered a horrific accident in July 2021 that unfortunately left Ian paralysed. Ian has spent 3 months in Galway University Hospital and subsequently was transferred to the National Rehabilitation Hospital in Dun Laoghaire, where he continues his rehabilitation through various forms of therapy. Unfortunately, Ian's worst fears came true when the doctors told him that he may never walk again and that he will be reliant on carers to assist him with daily tasks. In the interview, Ian is going to go through exactly what happened, how the accident came to be, the aftermath, the psychological effects, the physical impacts it's had on him, but also the financial burden that his family now face. The good news is Ian has sought further medical advice and looked further afield, and he's looking to travel abroad to Germany to undergo a different form of therapy through a combination of stem cell and hybrid assistive limb treatment. What this means is there is a massive, massive bill that Ian and his family will need to pay in order to be able to have a chance at walking again. And this is where we can help. The MMA community can rally around behind Ian. There is a Gofundme campaign set up in Ian's name to assist with the costs of getting over to Germany and participating in this treatment, and essentially to try and help Ian walk again. What I would ask is anyone watching this video today to please go to the GoFundMe, to share it with as many friends as you like. It's free to share, but also to donate as much or as little as you can. Every little bit is going to help Ian and his family. So please share the video, share the GoFundMe, get Ian's story out there, and please let's get as much help for him and his family as we can. And let's hope that we can get Ian walking again. Thank you very much for watching, and here's the interview. Ian Coughlan, it is great to see you. First of all, I really mean that. It's good to see you, and I don't know where to begin with this, if I'm honest with you. So I guess let's just start from the start. In your own words, what happened?
I was training in one of the friends. He got a little shed out his back garden converted. It's where we were all, me and Andreas Binder, a lot of people would know him, and Ryan Hanley and Carl McCannell, the guys. We were doing our training. Shed got converted into a little gym. We were all doing our training there. It was a sparring day. It was the last session of the week. And getting ready for a fight. I was supposed to fight Marcin Zambala, main event of IUR. And yeah, a guy just kind of basically threw me on my head, essentially. And I kind of went down in a diagonal way against the wall, and kind of between the floor and the wall, really hard. And that was me paralyzed. That's the essential part of it.
So it was just, by the sounds of it, a regular training session, and just a freak accident, essentially.
Yeah, I don't know what to say, really. I mean, it was a freak accident, but I certainly think the action that caused it to happen was quite reckless, So I don't know really I haven't really fully got my thoughts around the actual injury itself as to how it happened. I went for a double leg. He defended it by feeding me a single, so I ended up having a head outside single, and he kind of got his arm behind the back of my head and shook me down really hard onto the floor like that. So I don't know really what I make of it, if I'm being 100% honest.
Of course. And so you remember exactly what happened? Like, do you remember the aftermath? And there was no, like, did you get knocked out at all, or no?
No. I remember the actual second that my head hit the wall, I just started calling ambulance, ambulance, ambulance. Now I knew something was very bad, because like when training a long time, you get injuries, you get serious ones, you get not so serious ones. The second my head hit, I knew it was something really bad. A feeling came over my body like nothing I've ever experienced. And then of course, yeah, I remember the frantic wait for the ambulance and the trip there, and all the aftermath.
And so, you said it's something like you've never experienced before. Was it like an intense pain or a numbing?
It was almost do you know pins and needles, or is it pins and needles? Do you know if
Yeah.
your foot goes a little bit of sleep? It was like a very intense version of that. Kind of went all through my body, like a shockwave through my body. Yeah, something that's actually quite hard to describe, but that's probably the best way. Like really intense pins and needles just went through my body. And I've had in training before where parts of my body have gone asleep. One time sparring, the entire right side of my body went to sleep. And whatever way it worked, I really wasn't even nervous at all, because I kind of just knew I'd pinched a nerve and it would be fine, it'd come back. But with this, it was different. I just knew something. It wasn't even pain. It really wasn't pain. I wasn't in pain at all. But I knew something was very bad the second my head hit the wall.
And so, what are the next moments? Like I imagine it took some time for the ambulance to arrive, and were you brought, which hospital were you brought to, or what happened next in the aftermath?
Yeah, so as soon as I hit the floor, basically I called an ambulance right away. I was like, get me an ambulance. The guys there called an ambulance. It ended up taking about 2.5 hours.
Wow.
From what I was told, yeah. Their explanation was the Galway races. But that's just one of those things in the country. I mean, even in Dublin, getting an ambulance can be tough from what I hear, but
Yeah, that's crazy. 2.5 hours is crazy.
insane. I know, insane. So
And
yeah, 2.5 hours, and one of the lads, Ryan Hanley, got to say big thanks to him. He did a real good job of kind of orchestrating everything, keeping everyone as calm as possible. He was on the phone to the guy, to the dispatcher, and kind of told him to keep me on my back and not move too much. And the big thing I remember is all the guys were trying to kind of reassure me. They're like, no. I was telling them I'm paralyzed. I was saying it from the start. I was like, I'm paralyzed. And they were all telling me, no, you're not. And Andreas was telling me, because he had a fight before where he had a pinched nerve situation, and he got a bit of a paralysis, and he was like, no, it's just that. I know you'll be fine. And I don't know if they believed that or they were trying to reassure me, but I knew as they were saying that, I was like, guys, this is something different. This is something different. So they were all telling me, no, you're not paralyzed. You're not paralyzed. And my wife eventually came in, and she was very upset. And it was a crazy time. Just fear, to be honest with you, Andy. Just a lot of fear. It was just a different feeling. It was just, as soon as my head hit, I was like, okay, this is bad. It ended up being a lot worse than I thought it would be, but I knew it would be bad. I didn't know it would be this bad, but I knew it would be very bad.
What happens when you get to the hospital? Are you rushed into surgery, or?
No, so it was unfortunate timing, I suppose, because by the time I got to hospital, it was essentially Saturday night, really, with the long delay and with everything. So it was quite late by the time I got there. And I ended up being in kind of what I essentially call it acute ER, where like you have covers between you and the next patient, and other people will be coming in, and that's where I spent a good few hours. They eventually transferred me to a room upstairs, but it was a general room with other people. There was a lot of me asking every doctor who walked by, would I ever fight MMA again? I'll tell you that, Andy. Every doctor walked by, I was like, will I fight again? Will I do, and obviously at that point, they're like, we don't know. We can't tell you these things. So they eventually put me up in a room upstairs, and the first night was pretty crazy. I ended up having a bit of a panic attack. I've never had anything like that before. Throughout my time in the hospital, I ended up having 2 panic attacks actually. But yeah, I ended up having a real crazy panic attack. Which, funny enough, they ended up giving me medication for. And apparently, I don't have any recollection of this, but apparently my heart rate, like in all those, and my ops went down really low to the point where they were almost kind of worried about my life actually. Yeah. So apparently I found out afterwards, like the doctor was kind of hovering over me after that. After things stabilized a bit, the rest of the night she was constantly looking at me to make sure, and it didn't kind of relapse or whatever. But I had a really bad one as well when I got there, where I'd almost choked on my own vomit. And thankfully, I managed to make a bit of noise, get a nurse to come, and because obviously at this point I had the head mask on and all these things, so I literally couldn't move. But thankfully, they managed to hear me and turn me and all that. So yeah, the first night was a few close calls as well, actually, to be honest with you. The first night. So yeah,
it sounds terrifying, Ian. From one thing to the next, it truly sounds terrifying.
I fear like
do
nowhere,
you remember?
to be honest with you.
Yeah, like I know you said it was fear, but like, is there any way you can describe it, or
just the terror of unknown? I just literally had no clue what was going to happen. I didn't know how bad it was. No one could tell me, even if they didn't even know, no one could tell me. I had no clue. I remember one of the first things that really shook me was the nurse that was taking care of me downstairs, and I suppose you call it the ER. When they transferred me up to the room upstairs, he said to me, all right, Ian, I'll see you tomorrow. And I was like, I'll see you tomorrow night, sorry. And I was like, wait a minute, is this not going to be one of those things where I go home tomorrow? That really was like, oh crap. The fears that I was thinking were kind of coming true. When he said that to me, I'll always remember that. He goes, I'll see you tomorrow night. And in my head I went, no, you won't. I'm out of here tomorrow, man. Tomorrow morning I'm out of here. But deep down I knew it was going to be a very serious injury and a serious recovery process.
And so you spend the first night in Galway University Hospital, right? That was the first hospital. What happens next? Like, at what point are the doctors telling you, okay, this is what has happened to you, or this is your diagnosis, or the next steps? Like, what were those next steps as far as consultations with the doctors?
Yeah, so I think the accident happened on Saturday. Sunday, I was kind of floating around the hospital, probably a little bit of a haze because I was getting used to all the drugs they were having me on, I guess, and probably a lot of shock in my body as well. Come Monday is when they started putting me through MRIs and CT, I think maybe CT scans, all these things to check that I have damage to my head from the accident, and obviously to figure out what the exact injury was. They eventually told me that it was what they call edema, which is essentially swelling of the spine. We then had some discussions about surgeries, and that kind of really upset me because there's actually nothing is actually broken. So there was nothing that they could perform surgery on. So there was a real element of everyone just telling me we have to wait and see. And I'm like, no, we have to be more proactive. And they're telling me there's nothing more they can do. Like, there's no surgery for this. And that was causing a lot of frustration with me. I really was just adamant, like, there has to be more you guys can do. But their hands are tied. There's just no surgery for edema.
And so what were the next kind of days and weeks? And, it's 4 months on now. What was the kind of initial aftermath like as far as rehabilitation, or I guess any, if there was nothing they could do, or there was nothing to fix that was broken per se, what were the next steps?
Well, for 48 hours, they put me on catabolic steroids. That was their best attempt to reduce the swelling. I'd say for the first 2 weeks, I didn't really do much. I just kind of lied there with as little movement as possible, and I guess tried to get out of a bit of shock. Those first couple of weeks in that hospital, like, they were grim. They were really grim because, and I just couldn't sleep. If I was getting 8 hours in a week, I'd be lucky. I just could not sleep. So as you can probably imagine how long the days were.
Was it, sorry to interject, but was it because of pain, or was it more the mental side that you weren't able?
I couldn't sleep. At that point, there was no pain. A lot of pain came afterwards. at that point, from what I recall, there was no pain. It was just the mind racing constantly, as in like, what is this? What does it result in? What are the, like, even now, like in hindsight, like I feel really naive, because during the whole time, like the initial stages, all I was like is, will I still get to fight MMA again? Will I still get to fight MMA again? Kind of unbeknownst to me that, like, no, mate, if you get to walk again, that's huge. You know what I mean? Like, I really, I just didn't that was me big concern. Like, will I get to fight again? Obviously, little do I know, that's the furthest thing from reality. So, yeah.
And you spoke about obviously the mental side just now, and you have a wife and a young family. You've 2 kids, I believe.
2 stepsons, yeah.
Yeah, but like, what has life, I guess, like been for you guys as a family the last number of months?
It's been very difficult. My stepsons are at an age where they're teens now, so they're a little bit kind of, you don't get much out of them. You know, we try and talk to them about how you're feeling and things like this. You know, they don't say too much. But the wife was really tricky. She was work from home anyway, and her job gave her a lot of nice leave. So after the first couple of weeks, when things settled a bit, she was in the hospital with me a lot. So that really helped things. And at that point, we really, the hospital in Galway didn't quite tell me the severity of this injury. So me and my wife were quite, we're still fairly positive, you know. We're still fairly positive of things. And obviously being together definitely helped the days go better then. And we were doing a little bit of physio together, we could do, and things like this. But definitely a roller coaster of emotions. But I think, like, let's say from my wife's perspective, I think the past kind of month or so I've been tougher, because it's just been getting very real since we've been here. Since I've been in the NRH in Dublin, so they've told me the severity, and it almost seems like each week it almost feels like it's getting worse. What they're telling me, you know, a new thing gets broken to me every week, and now the big thing is adapting my house for me when I get back, and the cost of that is just going through the roof. You know, they're telling us we need to change this, we need to change that, we need to build this, and there's still an element of that. I can't believe this is happening. Does that make sense?
Absolutely. I think, like, but by the sounds of it, it's an additional stress on top of the physical stress of what you're going through. You then have the mental stress of dealing with what you're going through, and then on top of that, the financial burden.
Huge. It's actually it's huge. Like, what I've been saying to the people here is, like, this injury has taken my MMA career from me. It's taken a large amount of my life from me and what I love to do. But I can't believe I'm going to go into debt because of it. You know, and there is government funding, but it doesn't even scratch the surface as to what's needed. And that's a real tough pill to swallow. But, you have to adjust.
So you've transferred hospitals since then, and I believe you're now down in Dun Laoghaire, right?
Yeah.
So at what point did you transfer from the hospital in Galway?
So it was at the 10.5 week of recovery. So I'm not sure how long we're talking now. Maybe been here 5 or so weeks.
And what have those last five weeks been like, as far as rehab work or things like that?
In the absolute worst 5 weeks of my life. It has been absolutely horrific. The first couple of weeks here, rehab was really slow. The past couple of weeks now, it's been increased quite a bit, which I'm happy with. But as far as, like, the emotional side of it, it has been insane. What the doctors here told me, if you could imagine what my worst nightmares about this injury were, what they told me was like 10 times worse. I couldn't believe it. I just couldn't believe it. And there's other things as well that other things I didn't realize, like I'm almost embarrassed to say it, but like I had no idea that this injury affects like your sexual life, your ability to have kids and things like this. And then they tell you that, you're like, oh well, I just thought the worst case scenario was I couldn't walk again. Now you're telling me this. Then they're telling me that next thing you know, they're telling me that I'll never be able to drive a car again, even a disabled car. That's how bad my condition is. Then they're telling me that for the rest of my life, I'm going to have carers in my home 4 times a day. You know, and I just couldn't believe that. I was speaking to one of the physios, and then I was telling about when I leave her, how will I adjust to this? How will I adjust to that? And she just kind of looked at me as if surprised that I didn't notice. She's like, no, you're going to have carers in your home all day doing this stuff. And I was like, wow, I just couldn't believe it. I just couldn't believe it. So, and now obviously with the financial burden, because I knew that some money was going to be needed from my own money, because I knew the government money wasn't going to be enough to get the house in order, but I didn't know to this extent. So yeah, man, it's been very tough. It's just been very tough, but it's tough for everyone here. It's a crazy life altering experience. It really is. It's I just can't believe I didn't eat. Honestly, that's what really got me. The worst things I could imagine was worse when they spoke to me. So, yeah.
The first thing I want to say back to that is I really hope that you don't feel ashamed, because you have nothing to feel ashamed about. And I don't think anyone will look at you in that light at all whatsoever. So I hope that you know that. And the next thing, look, I don't know. I guess I don't know if how much you're comfortable sharing, but you know, I noticed your hand there, and you're obviously sitting. You're talking to me from a bed. So I guess, like, what mobility do you have at the moment?
So essentially, bar like stiffness, my kind of neck and arms and shoulders and whatnot were pretty much unaffected. My hands are very badly affected. I struggle to keep my wrists from dropping. That's a really bad one. I have very little movement in my fingers. So the hands are very badly affected by it. We're working on it, of course, you know, but there's only so much you can do. I can move my baby toes, my ankles a little bit. If someone was to push my knee to my chest, I can kick it away, but I can't move my leg to me. Obviously, no form of walking or standing. I can't turn in the bed. So there's flickers is what we were being told. My injury is what's called an incomplete injury. So some parts are unaffected, some parts are obviously badly affected, which is why something as far down the last end of the chain, which is my toes, can still work. So yeah, so it's restricted, but hopeful if I can get, you know, we talked about some work done, we can get a lot more out of it.
And so, Ian, what are the next steps? I know that there is a treatment in Germany available, hopefully available to you. What are the next steps in your rehabilitation journey and your road to, I don't know if I want to say recovery, but, you know, to getting a better life for yourself?
Well, yeah, so it's good you said that, to not use the word recovery per se, because there's gonna be physical consequences of this the rest of my life. There's just no ifs or buts about that. The big key is getting the most amount of ability back and the most amount of independence back. So the next stages now are that there's a place in Germany, and what they're doing is there's a lot of other places that we're looking at, but the main one we're looking at getting is to Germany. There's a thing called exoskeletal treatment, which is essentially you getting in almost like a robot, and it kind of trains your body to walk again. And I'm trying to mix that with stem cell treatment. So I'm hoping that can give a lot of results. I sent a video of myself on to one of the doctors there, and he actually thinks there's a lot of promise. So that's kind of a thing that's been really a big kind of a big sense of hope for me. The big key now is my discharge day here is the 18th of January. So the big key for me now is to get myself in a physical condition to where I can avail of those services. So like, for example, one thing my physio said to me, with the exoskeleton, I'll be standing up. But right now, because I've been in the bed and in the chair so long, I actually couldn't handle the altitude, for want of a better word, of standing right now. So I need to build up to those things. So I guess the key now is for the next, kind of just under 2 months I have left here, is to make the most amount of recovery possible to where I can avail of these things. Pardon me.
And so what does that look like, Ian? Like, do you have exercises to do on a daily basis? Is obviously your movement is restricted. So what can you do to progress your rehabilitation?
Yeah, so there's different stuff. So it's mainly broken down into physio and OT, but now we've added gym to that as well. So OT is occupational therapy. That's essentially them teaching me to do some of the practical life skills. So, and they have like certain pieces of equipment. So if you can't eat with a regular spoon, which I can't right now, unfortunately, they'll add an attachment to it, or they'll give you an extra big spoon or things like this. And they have to retrain you to do those kind of skills. So that's occupational therapy, trying to have the ability to dress yourself the most amount possible. So that's occupational therapy. That's probably 4 times a week. Then another 4 times I'm doing physio. So physio, as of now, it's mainly been a combination of what's called tilt table, which is a machine I go on which raises me up, which is to get weight through my legs and to simulate standing, pardon me, and also to get used to being upright again. That is being combined with sitting practice, which is essentially me sitting on the edge of a bed and trying to gain the strength to sit for myself, and eventually building up to be able to transfer myself from a bed to the chair and vice versa. So that's my physio. And then right now we're adding gym sessions, which is kind of a little bit of cardio stuff on the electronic bike, and then doing like doing exercises that will help with me doing transfers like dips, shrugs and rows and things like this. Obviously, it's with machinery that facilitates me being in a wheelchair. So that's kind of the breakdown of my day, or of my.
As far as the next steps of getting you to Germany, how can people help? I imagine this is going to cost a lot of money to be able to make this possible. You've already talked about, the cost of essentially having to remodel your house. I know that your teammate and friend that you spoke about earlier, Ryan Hanley, he had put out a GoFundMe previously, but I imagine that probably only covers a small portion of, say that the house aspect or the immediate aftermath. So I know that there's a new GoFundMe in play now for the treatment in Germany. So how can people help you to achieve that goal of getting over there and participating in that treatment?
Yeah, well, if you look on my social media, you'll see all the links you need. It's called Let's Get Ian Walking Again. It's a GoFundMe. I really dislike having to ask people for money, but if anyone can help me, this is kind of like me. This is really my final shot. The doctors here have told me I'm not going to be walking again without any kind of extra treatment. Like, I'm not leaving Dun Laoghaire walking. If I can get myself to Germany, maybe, they're giving me that fighting chance. So it's Let's Get Ian Walking Again. It's on GoFundMe. If anyone can donate to it, if they can't donate to it, if they can share it to someone else, if they can get a company or a business that maybe would be interested in getting involved, if they could send it on to them. Any help would be really appreciated, because it all adds up, and it could be the difference in me kind of enjoying the next 40 years of my life, right? Rather than, as of right now, being completely dependent on other people, which is just not a nice way to live. It really isn't. Everything from using the toilet to getting out of bed to putting on a t-shirt, everything's a challenge, Andy. Everything is a challenge right now. It's a horrible, horrible injury. That's all I can say. And I'm just going to do my best with it. And hopefully, like what I've been telling the doctors and the nurses here is, I want to grab the most amount of recovery possible And of course, the earlier the better, before the injury really kind of calluses and things like this. So I'm just hoping to get the most amount of recovery I can and really get as much independence back as possible.
Ian, I can't thank you enough for speaking to me today. It really is great to see you, and it's great to speak to you. I think it's safe to say I speak for the entire Irish MMA community when I say that we're all rooting for you. And you're a fighter, and I know that you'll continue to fight in whatever capacity that is to get that that level of autonomy over your life again. I urge everyone watching this, share the video firstly, like it, share it, blast it as far and wide as you can. Number one, that is free to do. Anyone can do it. You don't have to have money. But more importantly, please donate. You may not like asking for money, Ian, but I am asking anyone watching this video right now, please donate. I will be going directly to the GoFundMe to donate myself after this video. If you know anyone who has a business, please share to them. Please, as little or as much as you can give. You may not be able to afford a lot, but every little helps. And ultimately, we want to see Ian walking again. So yeah, I don't really know what this is. Unlike any interview I've ever done in my life, Ian. And again, I thank you so much for your bravery and your courage to speak and to share your story with us. And I hope to speak to you again soon, mate.
Thanks, Andy. Cheers, bud. Thanks, everyone.
And if there's anything you'd like to say, I don't know, to finish this off, but if there's any kind of closing message you'd like to give or you'd like to say, the floor is yours.
No, I suppose I'd just like to say just thank you to everyone for when this injury originally happened, for all the messages of support. It actually just meant so much, Andy. You wouldn't believe it. You're lying in hospital, and for someone to take the time to send you a message, and someone had that little personal touch of, you know, when I started as a white belt, you were the guy who came up to me and said hello to me and made me feel comfortable, or you helped me after class with a technique, and it actually meant so much to me. So for everyone who's always reached out to send their condolences and things like this, just thank you so much. That's it, Andy.
Thanks very much, Ian. We'll put the link to the GoFundMe on SevereMMA. We'll put it in the link to this video, and we'll blast it over social media, so it should be very easy to find. And again, please share and please donate, and I'll speak to you again soon, Ian.
Thank you. Bye.